There was a time when we thought addiction was the sole responsibility of the person consuming the drugs. Now we may have to rethink it and look at these institutions that distribute the drug. Are they enablers in this process? Are they culprits? We're going to talk about in this edition of the Armstrong Williams Show. Join us. Armstrong, 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 Dr. Neera Ganjottra from Johns Hopkins University is joining us, and Dr. Devin Smith. We talked in 2017 about this issue of addiction, and I must tell you, it was a very impactful show for us and many people that had an opportunity to watch. Where does the responsibility of addiction lie?
I would say it lies not only with the individual, the treating physician, society, family. Everybody shares some responsibility. While we can't change any one person's behavior without them being the willing partner in that endeavor, there are places where we have dropped the ball. In particular, oversight of pain management, managing diversion of prescription medications, as well as in the family, not confronting the behavior early enough. There's lots of places, lots of touch points where we could have an impact.
You know, many people have expressed having a euphoric feeling, Dr. Smith. Is that why it is so hard to rid people from this opioid addiction or other forms? And what role do you think the medical industry continue to play, and whether people are able to conquer this or whether they continue this addiction?
Well, I think as a veterinarian, one of the benefits is if my patients are getting euphoric, I don't have to hear about it, and they're not going to they're not going to have those addictions. But I think certainly that's one aspect that keeps people wanting to take more. I think as we've talked about on the segment about this discussion earlier, is that they realize it helps solve other problems in their life. So maybe you're taking it for back pain, and then you realize that other issues, it helps kind of alleviate them, whether they're mental health issues or whatever the case may be. And so then you get addicted to that aspect of the drug as well, how it's multifaceted. And I think, kind of like we were saying, there's a lot of players that need to take responsibility, but I think because there's so many aspects, it's really easy to blame everyone but yourself, everyone but the addict.
So let me come back to Dr. Ganjottra, who's also the instructor of psychiatric and behavioral sciences and clinical associate at the Johns Hopkins University. You know, we have these discussions, and what people often ask, particularly me as the host and the facilitator, tell us something new. Tell us something that we have not heard. I've heard this before. So I don't want to offend anyone, but I'm going to use myself as an example. I have not taken medicine in 33 years of any form, have not. When I've and I've had surgery, I had to be circumcised at age 26. I had to have my hemorrhoids removed at 34, and you know, you get so sewn up, and it's the most painful thing.
Sure.
And I'm telling you, it's so painful. I refused to take the medicine. I would feel my body in shock. It would last for hours and hours, but eventually something happened in my body. It kicked in, and there was a healing and a lessening of the pain that began to take place. And I began to gain strength day by day, and my body naturally healed from both processes. I'm not saying that people are weak, but I'm saying they have a low tolerance of pain. We make them believe they need to be addicted to these painkillers that take away from the pain. Because eventually, when you take away the pain, you're replacing them with another challenge.
That's exactly true, that pain medication carries risk. A lot of times that risk is not fully explained. We live in a society where if you want to get your work done, you usually can get your work done quickly. You open up an app on your phone, you get a pizza delivered. When you have pain, you go to the doctor, you want relief. If you have a surgical procedure, a lot of times pain medications are indicated. The problem is that the follow-up generally doesn't involve that discussion of the risk and what should be done to have the patient taper off of the medication without developing a major dependence. The issue of opiates treating all sorts of conditions is something that once a person gets used to having the opiate in their body changes. Changes to the point where they are not themselves when that opiate is withdrawn rapidly. In that regard, I think that proper treatment planning from the get-go, explaining those risks, is one part of it. The other part is on the prescriber and probably the patient to have a discussion about what is a reasonable plan. We can point fingers at any one particular bad apple, but people expect to get treatment when they go to the provider. They expect to get relief. The body does change, as you said.
So let's just talk about something that is just absolutely a fact, Dr. Smith, who's also a special correspondent to Howard Stern Holdings, is that this addiction and these drugs is an absolute business. People make money as a result of your weaknesses, and they understand your mentality, they understand your profile, and know that most people, without even thinking about it, will give in to these painkillers or these opioids. And yeah, there's a price. The price is that they make more money. Yeah. So what responsibility, forget about most individuals, because we already know from the past and the present what they're capable of. I mean, look at the high suicide rates now. Yeah. But what is it that these institutions of medicines and hospitals and the Food and Drug Administration and other that have regulatory authority and influence on it, what is it they need to do to change? Because it's becoming very destructive. It is the #1 cause of death in America today, the opioid addiction. I want you to think about this because I think I need to take a break. I'm not hearing like I used to hear, but I'm hearing now. We'll be back. Welcome back with our guests, Dr. Neera Gandotra and Dr. Devin Smith. The culpability of these institutions.
Well, like we said, there's a lot of institutions to blame, or at least that are responsible for the epidemic. And I think from the medical side, some of the things that we touched on, that Dr. Gandotra touched on, is the communication and setting an expectation and a plan with your clients before, during, and after treatment. Not, hey, you're post-op, here are your drugs. It's making a plan before you're even going into surgery. Of this is what's going to happen, and this is what we need to look out for, and this is what we need to do, as you know, your family members need to look out for, and so on and so forth. So that there's that expectation before you even schedule that surgery date that you're going to be on these drugs, and here's the potential implications of that. And one of the things that we talked about, I don't think we ever talked about on TV or live on the last show that we did together, is there are newer monitoring programs out there for doctors. And it's something that you and I was just starting to sign up for the Maryland one because I've moved from New York. And that allows, when it works, and it's government run, so it doesn't always work that well, it would allow us to go in and say, you know, this patient is picking up these drugs too soon. And so it will allow you to, if it works and when it's effective, to track how often is this patient getting this drug, how many other doctors is this person getting this drug from, and so on and so forth. So you can at least try and curb, again, if you know, the system is flawed and is still newer, and so there's kinks that need to be worked out. But I think if it's effective, that could be very helpful, because I can say, look, I know you got this yesterday from Dr. So-and-so. You're not getting it from me today, and here's the proof.
Would you believe that there are people and scientists and healthcare organizations hard at work to help people so they don't become addictive, that no drugs are involved, that they actually can recover through natural means. We sent our Howard Stark Holdings crew out to places across the country, and Arizona and other places, and we found this concept called Regenesis. I want you to take a look. I'm gonna cue this up because I want you to really, because we keep talking about the issue, and I want to make sure that people understand that not always they need to be medicated. I was going to go through this much later, but I want you to watch what they actually do. I think it's about a 3-minute clip, and America needs to watch this too. I want you to watch this clip and tell me, are you shocked by it? People are not aware of it enough. They need to be more aware of it, and that you absolutely believe that this can work. So what I want to do, I'm going to go to this clip, Regenesis, something that we've been working on in preparation for this show, to show that there are alternative ways to empower people instead of empowering drugs. Let's go to the clip.
Every day, more than 90 Americans die after overdosing on opioids, according to the National Institute on Drug Abuse. According to the Institute, roughly 21 to 29% of patients prescribed opioids for chronic pain misuse them, and between 8 and 12% develop an opioid use disorder. In October, President Trump declared the opioid epidemic a national public health emergency. The medical device industry says that it has innovative solutions to help people cope with pain that in many cases could serve as alternative solutions to prescription painkillers.
So there are very interesting, very promising technologies available that could potentially treat chronic and acute pain in ways that don't lead to the same addiction. And I'd also offer that there's a lot of medical device alternatives. We've approved about 200 different medical devices.
Medical technology companies like Regenesis Biomedical in Scottsdale, Arizona, are leading the charge on creating innovative medical technologies that can help treat pain and have the potential to reduce people's dependence on opioids. Medical devices like the one produced by Regenesis Biomedical have the potential to help patients avoid heavy dependence on prescription drugs before and after surgery.
Provant therapy is basically a transmission or generation device with a pad, or what we call an applicator pad. You actually take our applicator pad and place it on the area of pain, and the device generates an electromagnetic field that is absorbed in the body and allows unhealthy cells to become healthy again.
I would use the Provant machine twice a day, and I think it really helped in my decreased use of narcotics to control the pain, and it's gotten to the point where I have no pain now at all. In my recovery from my surgical repair, I was able to get back into the saddle, so to speak, back to work after 2 weeks, having used a medical device to control the pain. I think that medical devices that treat chronic pain can help decrease the addictions to opioids in our nation.
Well, from a medical standpoint, continuing research and development for any medical device that's going to take you off of opioids is important.
Overall, Mr. Brooks says it's important that medical devices be a part of the national conversation when it comes to solutions to fight the opioid crisis.
Frankly, patients should ask their doctor about what they know about a non-drug alternative to opioids. Medical devices that have a safety profile that's known and provides a alternative would be a great option for patients, and yet most patients don't ask or don't know to ask about that.
Dr. Gondortra, welcome back, Dr. Smith. Are you surprised by what Regenesis Corporation is doing in Scottsdale, Arizona? Are you familiar with this? You have constructive criticism. Will it work?
I'm not surprised. I think that there's a niche for all sorts of different treatments outside of medication. Biofeedback, cognitive behavior therapy, exposure therapy, as well as Regenesis. Now, I think the decision isn't made yet about how effective it's going to be. And, you know, every company wants to get a little piece of that pie. Everyone who wants to solve this problem also wants to put food on their table. And if they're looking at a way that works, clinical control trials will show that. Reviewing that data would allow me to make a more informed decision about whether I would implement it. But I think that it can probably fill a niche of some subset of patients. In reality,
And who are those subset of patients which niche that companies like Regenesis can sort of fulfill?
I would say the patients that you described just as yourself, patients who don't want to take opiate painkillers even after a surgical procedure, patients who have a fundamental resistance to that. That would be the niche that
But are we in the minority?
Probably.
Oh, yeah.
We are.
Probably.
Oh, absolutely.
And remember that we got a message, doctors, in the 90s and in the early 2000s, that we were not treating pain effectively. JACO, the Joint Commission, would come to hospitals and say, pain has to be the fifth vital sign that we check. And we got these directives to then treat pain. The problem was that 15 years later, we didn't look at the side effect of not managing the prescriptions. The prescription drug monitoring program that Dr. Smith mentioned is one step in that direction. Regenesis may have a niche of some patients who really want to be opiate-free as soon as possible.
But shouldn't everybody want that as a goal, Dr. Smith?
Well, I think everyone should want to be opioid-free. That doesn't mean they can't have opioids to help with the pain in the short term for 5 to 7 days after as post-op pain management, and then maybe implement something like the Regenesis machine to help taper off the drug use. But I think wanting to feel comfortable after surgery doesn't make you a weak person. And like we talked about, I think during the break, is that appropriate pain management, and this has been studied. You can research this. Improves recovery and decreases the chance of post-op complications. So why would you not want to be pain controlled? It's about how we implement it, as you've said many times, that needs to be managed.
What I'm going to do before we start up another discussion of this, I'm going to quickly go to a break because we're going to come back to the words of wisdom with our favorite pastor, A.R. Bernard, and hopefully we'll have a little more time for you to respond and get some final thoughts. I'm Armstrong Williams. Don't go away.
A philosophy of life has changed. You know, millennials have babies they get married now about 30 years old, age 30. They got things to do, so they wait. Or they got to finish paying off their student loans, so they got to wait, because each one of them leaves with a $33,000 per person student loan debt. They're living with their parents at home because they can't afford to find a place outside. Got it? So they're getting married now about age 30, and if they have children, they're having children at a later age, and fewer children. But if your ideology says you need to have as many children as you can, then guess who the future tax base and labor force is going to be? The children who subscribe to that new ideology.
And so welcome back to the broadcast. There's so many areas that we could cover on this topic. Where do we all agree that we've made progress, that give people hope? Because there's so many people that go through pain, and obviously they feel it's unbearable. They feel like as though they're dying. It's not even worth living. Sometimes it's so unbearable.
Well, I think we've made the first step in acknowledging there's a problem, because you can't fix it if you haven't acknowledged it. So I think now that it's in the national spotlight, we can start to implement ideas, structures that will help prevent this going forward, or prevent it to such a large degree at the very least. So I think that's the best thing that's happened so far, is that we're talking about it.
But one thing we can agree on, anybody who watches their diet and exercise can minimize all this. That's one thing that we have in our control, Doctor.
Well, we do have control over our health by the actions we take. But if you have a tooth problem, or you have an accident, something that might be outside your control, you have a sprain, or heaven forbid, an actual break in a bone. Once that occurs, you have to rely on medical professionals to give you information.
But even when you go through these procedures, if you're healthy, if you're not overweight, and you maintain a healthy regimen, it helps you to recover much quicker.
You will heal faster.
Yes,
Absolutely.
that is critical.
There's no
People
doubt.
need to do what they need to do because you don't know what tomorrow brings.
I don't disagree with any of that, that we have a responsibility as patients to be honest and as compliant as we can be. And then we have to acknowledge the society we live in. We live in a society where when you're hungry, you go through a drive-through and you choose something that may not be the best meal. Now, that's a personal choice.
No. We live in a society where we think a drug is the beginning and the end of all. It'll take care of everything. That's the society we live in today. It's made us lazy, where we're less dependent on ourselves, and we can take a pill or go get on a machine, and everything is going to be good and happy-go-lucky.
Well, that's the expectation that's been created. That's right. I don't disagree with, we expect to have instant gratification. And the pill may solve a lot of problems temporarily, but we don't calculate the risk long-term for that. At least if we have the information and we understand how we can minimize that risk, then you're making an educated decision about that.
Yes, listen, I cannot thank you enough for joining us for this show today, and thanking you, Dr. Devin Smith, and our wonderful team here at News Channel 8 and WJLA 7. I'm Armstrong Williams. Have another blessed day in 2018.